we have yet another revolutionary presentation on smart Ayurveda. That is what is showing up that our country can become a Vishwa Guru. Ayurveda is the Indian contribution to the entire world. Presenting before you smart Ayurveda.
Hello everyone, my name is Dr. Ajit from Nitya Engineering College. I am going to present you here Smart Ayurveda for Personalized Healthcare. As we all know the importance of personalized healthcare because we have undergone the situation of pandemic and we have very well experienced about it. That dragged the attention of immunity. Now the question is, how many of us know the level of immunity what we have? Definitely, it is a very critical because there is a lack of non-clinical individual immunity level assessment and also there is inconsistency in the diagnosis of this immunity level assessment that need to be standardized with technological support. Here we are to give the solution, that is what the prediction of individual immunity level assessment through the technological background. By knowing the way of life of an individual, it may be Ahara, Vihara Pathya, Apathaya, etc. So here we are going to check out and framework based on the inputs of Ayurvedic principles and Ayurvedic practitioners, and the response to those questions will be processed and the score of an individual immunity level will be determined, and that score definitely help the individual to consult doctors, medicines, home products and health consultants with the appropriate guidance. And definitely we know Ayurveda is one of the oldest form of medicine which can cure many of the disease without any adverse effect, and definitely an efficient personalized health care will drag the attention of the public and provides an holistic technological based solution to critical immunity level assessment of an individual. And definitely the usage of this technology will reach the Ayurvedic solutions, medicines, local spas which is available in this particular region and provides the global platform. And that is what the envisioned by our Honorable Prime Minister, local products to the global market. And our customers are public. And there is a lot of opportunity to reach everyone in the country. There are many things like schools, colleges, Ayurvedic hospitals, Ayurvedic colleges and corporate professionals and health department, educational department. So in order to happen all this, we required around 25 to 50 lakh in the next 2 years. As a product, to come out as a product, we required production cost, we required people's cost, we required maintenance cost, sales and marketing and service and maintenance. That required the branding of the product and perception. Finally, it concludes, what concludes is each one of us will be able to predict the level of immunity what we have through the technology, and that will be in their fingertips. Thank you.
Is it a curative medicine or is a preventive medicine that you are looking at, or preventive care or a curative care?
Sir, we are going to give a preventive care.
Is it a clinical based? Do you take the blood samples? Do you take any other samples of them to arrive at an index?
No, sir.
Or is it only like the Kaun app which started, asking a question like, did you come across anyone in the last 45 days? Or is it something like this?
No, sir. It is not to get the blood report and all. So we will be just giving them the virtual connection with the Ayurvedic practitioners, and our device is very novel, which will give the immunity score to the individuals based on their response.
Okay, this is not a device. This is an application.
It's a digital.
Yeah, it's a digital platform.
So it is not a device. Okay.
So we will also be giving a chatbot kind of a device to the hospital, sir. So that is also our next level. So at the first stage, we will be having only the software part.
Right. And wouldn't it be nicer if you link it with gadget based tracking?
Yes, sir. That can also be incorporated in the later stage.
See, you are trying to build this application based on the questions that you are going to ask for the patient. If you can have a culmination of both test based as well as your questionnaire based, I think that will be more beneficial and basic more advantageous. At least basic tests to understand the immunity. Many times, if you look at the psychology of human beings, sometimes, if they get a lower score, then they may, do not use it, or they may even, give a very wrong answer to a question also. That's one point. Second point, if you really want to make it more useful and user friendly, it's better you also take lot of inputs from the existing Ayurvedic practitioners. There are a lot of innovative thoughts are there, and I have been interacting with lot of Ayurvedic doctors. It's better you have an expert group on your team, so that they will guide you to make this a more robust or a more useful product. One more question, are you ready to go into the market?
Right now it is in the research phase, sir. So our technology experts are working in the technology part. Once the immunity index scoring engine is ready, we'll be launching a mobile application at the first stage. Then we'll be having a chatbot kind of a product, which will be having a physical product as well, which will be giving it to the Ayurvedic colleges and Ayurvedic hospitals, practitioners, etc. So which will really help them to use this in their practicing time.
Being a technical person, I have a lot of questions because you put it as a digital platform. So where is the platform? I see that it's just a questionnaire. It can be a Google form or an XLS file. What else? I mean, you talked about mobile app and all that. So what stage are you in terms of the digital platform being built?
So right now we are in the ideation stage, and we are also doing the research and getting inputs from the Ayurveda experts and practitioners. So as you said, like the novelty lies in the immunity scoring engine. So that is where our technology lies in. So when we compare with any Google form or any other technology, it is very, very novel. So it will be robust, as the panelists were guiding us. So it will be robust, it will be a efficient tool to know the accurate immunity score.
Being a technical person, I have a lot of questions since you put it across as a digital platform. So what is technology in it? Because it seems to be just an XLS form or a Google form.
That is what, sir. So immunity scoring engine we will be formulating. So that is the novelty in this product. So that is the basic AI based technology we are going to build, which is not existing in the market.
Yeah, but how many parameters you already collated till now? Just for a number's sake.
Yes, sir. We are in the ideation stage. We'll just focus on those things from now on.
So you don't have the parameters ready. You don't have the app ready, you don't have the platform ready yet, you're yet to build all of them.
Yes,
right?
sir.
That's
Yes,
the
sir.
stage you are in.
Yes, sir.
So you have an idea to build. So AI data analytics come much later, because you need to have the basic platform to be built first.
Yes, sir. So using AI only, we'll be building the first application, which will be the software, which will give us the immunity score.
I understand that you're still in the ideation formation stage, but you see that you seem to move between two extreme edges. You seem to be a tech company which is trying to build AI-based models. You seem to be a platform, you're trying to connect the doctors with the patients. I think you have to first resolve it. And
Okay,
coming to the AI and models, like what my co-panelist was saying, that comes little later. Till you build your own problem statements and you identify solutions, you can't expect a machine to pick up any patterns.
So initially it's software as a service, then we'll be having a product as well, sir.
Yeah, and the software cannot be built on the top of a questionnaire. In fact, if you visualize the problem in a better manner by collecting certain vital parameters from the user, not asking him from the questions, some technical parameters, the machine should be in a position to frame the questions. But you're yet to figure out a good solution.
Problem solution fit.
Yeah.
Yes.
There is no market fit as such.
Thank you very much. It was a wonderful presentation.
Thank you, sir. Thank you all. Thank you.